morning.
Morning, Jim.
Good morning. Good morning.
My name is James Donmoyer. I'm the executive director of Lebanon County Drug and Alcohol. I'm here today to present two things to the commissioners. The first thing I'm here to present is contracts for the 2021-2022 fiscal year. And I'm also here to talk about the 2021-2022 budget. So the first thing I'd like to talk about is the contracts for 2021-2022. I provided the commissioners with a list of all the contracts that the Drug and Alcohol Agency currently has. We have a total of 43 provider contracts. Out of those 43 provider contracts, there's over 65 facilities with those contracts. And Lebanon County has a full continuum of care for Lebanon County residents seeking drug and alcohol treatment. There are no new added providers in 2021-2022. We are not adding any more facilities in 2021-22. However, we are adding some programs, more programs. A total of 6 new programs will be added to those provider facility contracts. I did provide a list, new additions and changes, along with this list of our current contracts. You can see we're adding some new programming at Pyramid, who we already contracted with, but we're adding programs with. We're adding programs at White Deer Run. We're adding programs at Bradford Recovery. You'll see there has been a name change with the Penn Foundation. You'll also see on here where we dropped our contract with the CAP, Lebanon County CAP, and that contract was assumed by Mental Health IDEI. We are contracted with them instead of CAP. So those are the contracts. The rates on the contracts have increased. There's a couple reasons for that. Basically, the cost of living is one factor. The other factor is COVID related. And the third factor is all the providers in the state of Pennsylvania need to become ASAM aligned, which replaced the PCPC last year. So there are costs that the providers are incurring. They will incur, and that's the reason for some of the rate increases.
Would you, for the sake of the attendees, tell us what the acronym is for ASAM?
ASAM is substance abuse. It's basically what we use. It's an assessment tool that we use to determine the level of care for someone entering treatment.
Excellent.
So we use that. That's our tool. It used to be the PCPC, and the state changed that and turned it into the ASAM. So it's just a different tool for when we assess folks going into treatment.
Thank you, Jim. Okay, anything else before we ask for a motion? We good, Jim?
Yes, I'm good.
Okay.
All right. I'll make a motion to approve adoption of the 1921. That would be nice, right?
I wish.
2021-22 contracts as presented.
Second.
Okay, it's been duly moved and seconded. Any further discussion? If not, all in favor, please indicate by saying aye.
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 Opposed, same sign, so moved.
Okay, the second thing I have is the 2021-2022 drug and alcohol budget. I want to point out in 2020-2021, our current year, our budget for revenues was $1,994,720. In 2021-2022, our revenue budget will be $2,172,725. So it is an increase of $178,005. I also want to point out for the commissioners, in the past 8 years ago, our budget set at 1.237,686. So in 8 years, our budget has just about doubled at drug and alcohol. That is a good thing because The budget's doubling because we are receiving more money from the federal government and we're receiving more money from the state government. It is not costing the county any kind of increase in participation. Just some things I want to point out this year. One thing you'll see on the revenues, compulsive gambling, you'll see for 2021, 2022, we're only receiving $33,800. And you can see the year before we received quite a bit more. That's due to the lost gambling revenue as a result of COVID. So counties are getting less money through compulsive gambling funds through DDAP. However, DDAP has turned around and graciously gave us more federal SOAR money. So as you can see, in 2021-22, we'll be receiving $458,208 in SOAR money, which is a substantial increase from the previous year. So we lost the gambling money and basically they backfilled it with more SOAR's money. And actually we came ahead, a total coming ahead of $59,034. If you go down the revenues, you'll see federal funds. Our federal funds also increased for a total of $46,000. So between federal funds and the Department of Drug and Alcohol, we're receiving over $105,000 more in funding. You'll also see that we received a $30,000 increase from the Department of Public Welfare for BHSI funding. And you'll also see, as you move down further the revenue list, the county funds for rental. In 2021-22, it'll be $192,489, which is $43,000 more than we got the year before. And the reason for that is because during COVID, we provided the Arcadia Health some relief from the rent. So this year, now that we're through COVID, the rent will go back where they'll be paying a full years of rent, where I believe this year they paid 9 months. So that's the difference. That's why it seems to be an increase. But, you know, again, we gave them a break in the rent through COVID. So financially, budget-wise, the Drug and Alcohol Office is in great shape, in my opinion. Again, as always, we're not asking for any county support. The county general fund, we have ample money to do what we do.
You need a motion to approve your submittal.
I would ask that you have a motion and you approve the 2021-22 budget.
I'll make a motion to approve the budget as presented, and then I do have a question.
I'll second the motion.
Okay, Commissioner Litz.
Thank you. Jim, on television, I see so many gambling venues where people can do it electronically. Does the state not get a portion of those funds?
That is something that I really don't know and don't know the answer to. All I know is what we're told is, you know, under compulsive gambling, I don't know what that includes in the state of Pennsylvania. I don't know if it's just in-person casinos revenue. I don't know if it's online gambling revenue. I could not answer that for you. That would probably be a question for the state. All I can tell you is that, you know, as our allocation, you can see that we took a decrease in compulsive gambling funds. But then DDAP, like I said, was gracious to backfill it with SOAR's money.
I understand. I just didn't know if they were undercutting the source of revenue to treat people with the addiction.
No, they're not. They're not. They're just, we have the same amount of money. In matter of fact, we have more money in 2021, 2022, with the combination of SOARs and gambling. The amount we have is more than we had in 2020, 2021. It's just the fact that less is coming through the gambling part of it.
I understand.
So it's not affecting.
It's more in the taxpayer realm than those who are doing the gambling.
Correct. It's more federal money coming through taxes, you're correct, than people gambling.
And is any of that the ARP funds? American Rescue Plan funds, do you know? That
No,
will disappear?
No, I don't think that the state or anyone has allocated them into that kind of category just yet, or if they are. And as far as the online gambling goes, I think that is a question for the state. I mean, we're just on the receiving end of whatever the revenues end up being, but without knowing for sure, I'm pretty certain the legislature would be chasing down any kind of revenue for online gambling, just as they did for in-person gambling. If maybe it's a matter of catching up or something to the industry, I'm not sure.
They
I'm
did
not sure
that with
either.
sales tax too, yeah, to catch up. Thank you, Jamie and Jim.
We have a motion and a second. Anything further, Jim, that you want to add?
No, sir.
Okay, otherwise, I thank you for such a good budget and for the continuum of care that you've developed over the years in your department. You know, that we have this wide array of services available in Lebanon County, and we have the funding to take care of them. So I think overall, you hit the bullseye on that. So thank you.
Yeah, the only thing I'd like to say, Commissioner, is I want to reiterate that if someone is in need of drug and alcohol treatment, Lebanon County has the full continuum. We have the contracts available to us. We have the funding available to us that we can help people in our community. I also want to, my staff, my entire staff, proud of my entire staff for, like I said, when a budget increases just about, it doubles, along with that comes a lot of work. So, we are building new programs. We're making sure existing programs are still moving forward. So I think it's a credit that we could grow the budget double in 8 years. So I just wanted to put that out there.
All right, thank you, Jim. All in favor of the motion, please indicate by saying aye.
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 Opposed, same sign, so moved. Jim, happy Father's
Thank you. Thank you.